Good afternoon, Professor Gamal.
We have today 55 years old male patient with cancer in bank implemented with EOS FNA guided histopathological implemented to be adenocarcinoma causing double obstruction periduodenal ERCD biliary stenting done yesterday, and today we will insert duodenal stent for gastric outlet obstruction. Now we introduce the sheath with wire. The structure but can be passed successfully after dilatation with insertion of biliary metallic stent. And now, as you can see in the endoscopic view, there is tight structure between D1 and D2. We successfully passed a sheath with injection of contrast as shown in the CR picture. اسحب الورق بتاعك. اسحب.
Yes.
Okay, خلاص. We will use uncovered duodenal stent wall flex from Boston, 12 millimeter length, 120 millimeter diameter.
Professor, there is a lot of discussion that EOS guided gastroenterostomy is considered nowadays superior to a duodenal stent. What is your thought about it, and why do you prefer a duodenal stent over a gastroenterostomy over here?
Yes, this is one of many options for this patient to do EOS guided gastrojejunostomy, and also duodenal stent is another option. Especially we do biliary drainage first, and so we can now to introduce the duodenal stent without fear of causing biliary obstruction to the patella.
I think an important point here, especially for the trainees in the room, is that, like was excellently demonstrated here, you always try to decompress the bile duct before you place a duodenal stent, because you're going to jail off the ampulla when you do this. So in most cases, unless you place it very carefully. So it was very nicely done to do it in this order.
Thanks.
Absolutely.
Professor Gamal, are you going to introduce your stent?
Yes,
the stent is
we will
introduced now.
introduce the stent now.
What size stent is this? A 9 centimeter or a 12 centimeter?
12 centimeter. Sorry.
One of the challenges with the duodenal stents is that they do foreshorten quite a bit, and therefore I think it's important to keep watching the end of the stent on the endoscopic view, because otherwise the stent can get pulled inside and you can have a nightmare.
We see the distal end of the stent over the CR in a good position, and by now we will fire the proximal end of the stent.
Yes. I think excellently demonstrated. Wonderful.
Excellent.
Excellent.
Excellent, yeah, excellent, Professor Gamal. Excellent.